Dilation, self-explanatory, 0 to 10, huh? So you get this. I don't have to go on and on and on about that crap. Okay, so 0 to 10. And then station is the degree of descent. The degree of descent in the pelvis. Now, when we have true labor versus false labor, you want to make sure you know with false labor, the contractions are irregular and inconsistent. Irregular, inconsistent. There is no change with activity. So you didn't get effaced, you didn't dilate more with activity. You ain't did nothing. The patient feels it in her abdomen instead of her back and then her abdomen. It's only in the abdomen. They're annoying for her, but they do not cause you to dilate or efface. With true labor, those contractions are regular. They don't go away with walking. They get stronger with walking. They start in the back and radiate to the front. They cause cervical effacement and dilation. So what is false labor called sometimes? Braxton Hicks. Now, I'm really kind of funny acting about my nurses calling things false to real people because it hurts all the same to some people. It hurts really bad. So I say, no, don't tell them it's false. Say it's some pre-cooking, a little pre-warming of the uterus. It's doing a practice run. It sounds better to tell somebody that the pain that they're feeling is false. I don't like that. So it says a practice run. See if you're ready. See if your bags are packed. And that makes you feel better. Now, some warning signs that things are really, truly, probably going to happen. And I always say these happen within the week. And they're like a select all, warning signs. You pass something called a mucus plug, which is essentially like a little cork in your uterus, in your cervix to keep the baby in. It's like a little mucus cork. So you pass the mucus plug. You have a bloody show. So you have an actual bloody show, which is pink, usually, and this is 24 to 40 hours before you go into labor. A bloody show, 24 to 48 hours before you go into labor. It's called a bloody show. It's like a pink mucus. It is the mucus plug coming out with a little bit of blood tinged on it. It's called a bloody show. Mommy loses a little weight. Like, don't get excited, just a pound. They do get excited. Any weight loss is very happy. So they lose about a pound or so. They get a burst of energy. All of a sudden the house has been cleaned. Hadn't been cleaned in months. But she somehow found energy from somewhere to clean up everything. Nesting, which is now we're going to wash the clothes one more time. Now we're going to refold every blanket ever bought. I did it all. I remember that. All of a sudden you get all like excited about this baby, and you make the bed twice. Like, what is that? I don't know. You know, you start thinking, did I get everything on my registry? Oh my God. Shit you'll never use. But you're doing this because you're getting ready. It's called nesting. And then you buy another bag of diapers or some stupid shit like that. And then you have lightning. Now that's important. Lightning. We say it in layman's terms, the baby dropped. It really means the baby is becoming engaged. The baby's becoming more engaged in the pelvis. So this patient who's had lightning or the baby becoming more engaged, now they got to pee more often. But they dropped, so that's a good sign. More and more Braxton Hicks. They're coming more often. Mommy might not feel good. Maybe like a little mild flu. She just doesn't feel good. Doesn't feel that great. She doesn't care if she eats. She doesn't feel that great. Okay. Or the water broke. That's going to buy you a room at the end. So the water broke. So if you look here, spontaneous rupture of membranes, your water broke. Spontaneous rupture of membranes, the water broke. That is going to have to be checked because we don't know if necessarily it broke or the baby kicked you in the bladder, which can happen. So in order to figure out, did it break? We have three things we look at. We do a pelvic exam. The nurses usually do this, or me if I'm there. And we check three things. We check pooling of fluid in the vaginal vault, or deep in the vagina. We check nitrazine to see if it's positive. Remember, everyone, positive is blue, and this is because of alkalinic fluid. Amniotic fluid is alkaline. Negative is yellow. And then we also check something called ferning on the microscope. Looks like a beautiful fern has grown on the microscope. The nitrazine is important because amniotic fluid is alkaline. Now, the fluid timing is important. When did the water break? Because in 24 hours, we really need a baby out. When did the water break? What color was the water? Was it clear or was it meconium? God forbid it was bloody. I don't hear that very often. But it might have been green, which is meconium, which is ugly. Is the patient positive group beta strep or not? Are they positive HIV or not? All of this is putting the baby at risk because as soon as the water breaks, infection can get to the baby. If we get an infection in the uterus because the water's broken and we just do, it's called chorioamnionitis. Chorio for short. Chorionic villi is the placenta, as you may recall. So if there's an infection, usually from group beta strep, but could be they have an STD you didn't know about, like trick or something, and they can get an infection of the uterus, placenta. It's called chorio. Now our baby's in trouble. On this sheet, I want you to write 5 P's. You've got a lot of room on that sheet. Use it up. Put your 5 P's. One is passageway, which is the actual pelvis itself. And these 5 P's determine how well labor is going to go. So the pelvis does matter because there's a lot of different types of pelvises. You could have a normal pelvis, gynecoid, or you could have a male pelvis, android. I tell you, gyne for woman, Andy for a boy. Gyne for female, Andy for a boy. Or you could have anthropoid or platy. You don't care about that one. These two are C-section. You don't care about the spelling. I always call it platy or anthro, but it's C-section. Platypoid, anthropoid. Think of anthropology like an ape. Who needs that kind of pelvis? So those are rare, really rare, but they can happen. So passageway is pelvis. Passenger is your baby. What in God's name is your baby doing? Is it breech? Is it vertex? What is it doing? If it's not doing those things that it needs to do, like head down, labor may not progress. Powers are the contractions or maternal pushing. Powers are contractions or the maternal pushing. Psyche is mom's emotional state, something that my students know well, and I always make sure you guys know. Let's look at the emotional state. Remember it like this: maternal anxiety leads to something called catecholamines, which leads to vasoconstriction, decreased blood to uterus, and I might add placenta, and increased pain, which just makes the anxiety increase. And we start the roller coaster ride all over again. That's called maternal psyche. She got to be in the right mindset. Position of the mom. Position, the P, the last P is position of the mom. Okay. Something you probably should write down is it's called Friedman's curve, to give us the best guide for progress in labor. Friedman's curve. Friedman's curve gives you the best idea of progress in labor. Now, if you turn the page till you get to stages of labor, oh, go backwards. Thank you, baby. Go backwards. Flip the page backwards. You already know this is important, huge importance. So we spent a little bit of time on this because it's huge. especially with regards to what you're going to do during each stage. Okay. The problem is the confusion, huh? So let's just make sure we're clear. Stages equals 4. That's it. 4. Stage 1 is labor. Stage 2 is delivery. Stage 3 is placenta. Stage 4 is recovery. Stage 4 equals 4 hours. That helps. So there's 4.